dive right in. So good evening, everyone. Thank you for joining us this evening. As some of you may know, my name is Brent Leonard. I'm a member of the board at Lupus Ontario and will be your host this evening. Also joining me this evening from the Lupus Ontario side is Hadra Batul, our master of everything, it seems, especially social media. She'll be working in the background to make sure tonight's event is seamless and smooth. No pressure, Hadra. A quick note and reminder that as with all webinars we do, this will be recorded and made available on the Lupus Ontario YouTube channel in the coming days. So if you're able to join us for a part of this evening's event, but not all, you'll be able to get caught up on the festivities in the next few days on our YouTube channel. So please do check that out. Our webinar this evening is on the transition of care from pediatrics to adult care. We're pleased to be joined by Dr. Stephanie Wong and Nameerah Hassan for today's presentation. Dr. Wong is the 2022-23 Lupus Ontario Geoff Carr Fellow. Having completed her MD at the University of British Columbia, Dr. Wong is expanding her clinical experience at SickKids Hospital in Toronto and also attending the transition clinics at Mount Sinai and Toronto Western. Nameerah Hassan is a lupus warrior, contracting double pneumonia and experiencing a month-long hospital stay at the age of 12. Nameerah began exhibiting other hallmarks of lupus, such as fevers, muscle and joint aches, migraines, and blood clots. She was treated by the incredible team at SickKids Hospital and eventually diagnosed with SLE and antiphospholipid syndrome. Nameerah and Dr. Wong, thank you so much for joining us this evening and for this talk on the transition of care. I'll turn things over now on our virtual stage to you for the presentation. Thank you.
Perfect. Thank you so much, Brent, for that introduction. So yes, I'm Dr. Stephanie Wong. I'm one of the clinical lupus fellows at SickKids Hospital. And Nameerah Hassan is our lupus warrior who will be telling us her story. So the title of today's webinar is Transition of Care from Pediatrics to Adult Care and Preparing for the Next Chapter. So this is our agenda for today's talk. We'll start the talk about discussing some differences in adult care coming from pediatric care. Then Nameerah will tell us her story through transition. We'll then touch on some common adolescent issues, some tips and tricks and kind of how to prepare for this transition. And then hopefully we'll have some time for some questions at the end. Let's get started. So what is transition? So the definition is the purposeful planned movement of adolescents and young adults with chronic physical and mental conditions from a child-centered to adult-centered healthcare systems. So why do we care? Well, it's a known time that there can be adverse outcomes during this period, including gaps in care, unscheduled healthcare utilization, loss of insurance, and high disease activity. Therefore, it is an important priority in your care and your future medical plan. So looking at some differences between the pediatric care and the adult side. So generally on the pediatric side, we're much more family-centered. So parents are in the clinic room with you. They play a major role in decision-making of your care, while on the adult side, you're now the main decision maker. There's generally less independence on the pediatric side as your families are there to support you, reminding you to take your medications, booking your appointments, while in the adult world, some of these activities are just expected that you do this on your own. We generally have more time during visits in the pediatric side, and we tend to see you more frequently, potentially, compared to the adult side. We also have a larger interdisciplinary team, and access to allied health is generally easier. So you can see physio, occupational therapy, social work, other allied health professionals, while the adult side, your team may actually be smaller. So you could have your main kind of physician plus a nurse, and that's about it. And you might actually need to make separate appointments to see these allied health professionals or other medical teams. Well, I know on the pediatric side, we try our best to coordinate these visits on the same day if possible. So adult care is different. So as I alluded to in the previous slide, there's some things that they'll expect. So one is to meet with you alone. You can have your family or your parents or support people with you, but only with your consent to be in the room as well. We'll ask you questions about your condition and your health. We expect you to know your medications, your past treatments, and then we expect that you take responsibility of your care and kind of management plan. We'll ask for your opinion and your ideas in planning your care. We'll ask for consent, depending on what treatment managements we can offer you. We hope that you do your blood work prior to your visits so we can kind of review those results when we see you. And one major difference is that we expect you to follow up with them if you miss an appointment, rather than our secretaries on the pediatric side, chasing you and trying to rebook. So that's put back onto you in terms of your responsibility. So how does your lupus change, or how does your treatment change over time when you kind of get on to the adult side? Unfortunately, we don't have a crystal ball, and I can't tell you, what will happen in the future. We do know that on the adult side, we do focus a lot on preventative measures. So we screen for things like high cholesterol, cardiovascular disease, bone health, monitoring your weight and your physical activity, and other things that just tend to change when we get older, unfortunately. And as you approach the age of potentially, wanting to start a family and pregnancy planning, we'll have to kind of plan that ahead of time, which may mean closer monitoring. It may mean referring you to a different rheumatologist who specializes in taking care of lupus patients who are pregnant, as well as changing your medications to make sure that they're safe during pregnancy as well. And, in terms of how your treatment may change, so some medications are based on your weight, or your size. So depending on that, we'll also change that as you get older. We will emphasize even more the importance of regular eye exams, especially when you're on hydroxychloroquine, as we know that it's the cumulative dose and kind of higher doses that can affect the retina or the back of the eye, causing vision loss. So some of the young adults, by the time they even see us on the adult side, they've been on this medication for 5-10 years. So that's even more important to continue to be monitored depending on when you're diagnosed. But on a positive note, there are a number of medications that are offered and available to you now that you're technically an adult. And it's much easier access for these medications as well. And now I'll pass it on to Nameerah, who will share her transition story.
Hi, everyone. So my story starts when I was about 12 years old. So as Brent mentioned at the beginning, I caught a pretty severe case of double pneumonia. Well, I originally had bronchitis, and then bronchitis, if left untreated, develops into pneumonia. So that's what happened to me, and I ended up being in the hospital in my local city, Mississauga, for about a month, receiving treatment. This was obviously the first time in my life and anyone in my family had been sick. So we were a little bit confused, but I recovered after a while. 6 months later, I was feeling a bit better. But since then, I was having consistent things like consistent fevers, headaches, just some general weakness, and just random pains throughout my body in the 6 months after my pneumonia, which led me to, the ER a few times, and we couldn't really figure out what was going on. And then eventually I realized that my leg was really, really swollen. I was unable to walk. I had a really stiff leg. I thought, I was like, maybe I sprained myself, or maybe I broke a bone, right? In my head, I never even heard of a blood clot. So, I went to the hospital thinking, I just injured myself. And then they were really, really concerned at my local hospital. And they weren't really telling me what was going on. I just had a bunch of tests ran on me. I got a CAT scan. I got a ultrasound, a bunch of things. And then they kind of told us what was going on. They said it's highly unusual for a 13-year-old to have such a big blood clot in their leg. So they actually made a decision that night to transfer me over to SickKids. So eventually when I got to SickKids, they assessed the situation, they took my medical history, and from there they decided the best course of option was to go forward with a procedure called thrombolysis. So it's basically going into your vein and trying to break up the clot through using a catheter device. So they did that procedure the next day. It was kind of successful just because the clot was so big. It was difficult to try and break it up without the risk of damaging my lungs, my heart, and my brain. So they just kind of broke up the clot enough to get some blood flow, and then they treated me with blood thinners in the hospital. And so prior to this, the only thing I knew about lupus was from the show House, and I knew that it was never lupus in the show. So when they told me that that's what they were testing me for, my whole family was laughing because we're always like, "What? It's never lupus." But in my case, it did end up being lupus. After quite a bit of testing, I was still in the hospital, but by the time I got discharged, they didn't tell me for sure I had lupus because all the tests weren't back yet. But within the next few months, I got follow up in the hospital, in the SickKids clinic, and there they gave me my diagnosis of SLE and also the blood clotting disorder, antiphospholipid syndrome. So, you know, honestly, I always say like SickKids was probably the best place I could have gotten my diagnosis because, I had absolutely amazing support, great doctors. They supported me through everything. Like if there was one thing wrong, I was immediately at the hospital getting all my tests done. Things were dealt with fast, and I got like my specialists immediately, and everything was kind of in one hospital. So that was easy for me and my mom since I had to go to different clinics within the hospital. And as Dr. Wong mentioned, they always would kind of arrange it so that they all happened on the same day, which was really nice. And so, yeah, like, I mean, I had a lot of flare ups over the years. I had more blood clots. I developed more symptoms of lupus over time, as a lot of patients who initially present with blood clots do. And yeah, and then I eventually ended up switching. Actually, sorry, let me just catch my notes here. Yeah, and then I had a few other random instances. I'm very clumsy, so I ended up tearing my ACL, which actually ended up being like a joint bleed in my knee that I didn't realize because I'm on blood thinners, and that caused some permanent damage in my joint. And just things like that. Like I had a lot of mobility issues throughout high school. There was a time when I was coming to SickKids every day just to do pool therapy so I could walk. So I had a lot of resources available to me, like being able to just do that therapy every day with a specialized trainer with me was amazing. I mean, I feel like I haven't gotten that kind of treatment since being an adult. But yeah, and while I was a kid, I took a lot of care about in my personal life. My health always came first. My family never put any pressure on me in terms of school. Throughout high school, I took a light in course load, and I took an extra semester to finish off my credits just so that I can do it at my own pace, which was very nice. I had amazing support from my school. They let me do individual courses or working with a teacher one-on-one to get my credit, which was really great. And then, yeah, when I turned 18 is when I started transitioning out of SickKids, which is really sad, but it was time. I actually kind of started transitioning even by the time I was 16, 17. I was going to my appointments alone. I knew my medical history like the back of my hand, like I could recite it. So it was really not too challenging for me to transition into adult care just because I kind of became very hyper independent as a result of my illness. So, we had our transition day at the hospital, where we met my new doctor, Dr. Simon, was present, and all the doctors actually of the clinics were present. We met every single person. They kind of talked us through how transition would work. They gave us a lot of resources. It was overwhelming at the time, but honestly very useful, like in the future, things like disability, things like support for school, like applying for your accessibility services, things like that. That all were very handy to me later on. But yeah, it was an overwhelming transition, but I did end up getting transitioned to Mount Sinai, where I see the lovely Dr. Wong. So what actually ended up happening was I transitioned in 2019, so that was just a year before the pandemic. So prior to the pandemic, I just got diagnosed with another really rare autoimmune disease called Evans syndrome. So this led me to being hospitalized 3 times in 2019, with episodic flare-ups of this illness. So I was getting I had to take really high dose steroids, and I was on a cocktail of pills and things like that. But eventually my Evans syndrome went into remission, luckily prior to COVID-19, because right after that is kind of when things settled down for me. But then the pandemic happened, and there was a lot of barriers to care, I would say. Like The doctors weren't as readily available, of course. It was very difficult to get in-person appointments. Everything was virtual for pretty much the first like 2 years, aside from like having a yearly in-person appointment. And I've been, you know, I had a lovely team like at SickKids, and then I got transitioned to a few different doctors, one of which is in Toronto General. So just kind of like managing the care between two hospitals is a little bit more difficult. Sometimes the doctor can't access certain tests, or they don't have access to results. So that can kind of slow things down. But overall, my experience transitioning has been pretty good. Dr. Wong and Dr. Simon are currently my doctors at the young adult clinic, and I'm actually getting ready to transition to full adult clinic, which is kind of scary, but I would say like I felt so supported throughout the whole thing. And yeah, I sorry, I feel like I've been talking for so long, but I will probably have more points as to my transition when we continue on with the presentation. There's lots of different things that I went through, and different supports and resources that I used as the time happened. That's just kind of like an overview of my story and how I came from SickKids to Mount Sinai.
Amazing. Thank you, Nameerah. I know it feels like I were talking for a long time, but your story is always an excellent one. Okay, so we can talk about a little bit of kind of how to prepare for this transition. So we have a few tips. One I like to use, and we talk about this with the adolescents as well, is this 3-sentence summary. So it's a quick summary of who you are in your care and kind of what you're bringing up to clinic on that day. So the first part is your age, your diagnosis, a brief medical history, then your current treatment plan, any questions or concerns you want to bring up to the doctor that day. This usually doesn't come very naturally for some when we see you in clinic, because we've seen you for so long and we look at your past notes and we just know you very well. But when you meet a new doctor, that's really important to have that summary in your head that you can present to them, and they know that you know your history. So Nameerah, I don't want to put you on the spot, but what would be your 3-sentence summary?
Yeah, so mine would be that I am 22 years old. I have the primary diagnosis of systemic lupus and antiphospholipid syndrome, with my major health history being blood clots, and my like DVTs and PEs. And currently I'm taking Plaquenil and Apixaban. And at this visit, I wanted to talk to you about my crippling fatigue and joint pain.
Of course. Perfect. So other tips that we like to include is, one, be informed. So ask questions. Don't be a passive participant in your care. This is you. This is your body and your disease. So you can read about lupus and your management, and you can have an opinion on kind of next management steps. The next would be honest with your doctors. So it's important to know if, say, you haven't been taking your medications because of stress, exams. There's a lot of things that go on in your life, but it's hard for us to take care of you or make, informed medical decisions if we're just assuming that you're taking your medications as prescribed, because then maybe that means that this medication is not working for you. You're not responding to this current treatment, and then we actually may need to change your treatment. But if really you're taking your medication once a week, maybe it's just not quite optimized at the time. Next would be to be positive. I think talking to the young adult patients, a lot of them, they've accepted their diagnosis. They found the good in being different and being, individual and just being your own person. And, just like Nameerah, you can be an advocate and be a lupus warrior for your disease. And, next, being your own advocate, ask questions, get the information you need before you make any decisions. You can always include your parents or other family members as you see fit, but remember, it's your body and ultimately your decision. So next we'll talk about kind of emergency planning. Sometimes we don't think about this, especially when we're feeling well, but it's important to have something in place, just in case. So first questions to kind of ask yourself is, what will happen if you get sick or hurt? Where can you get help and support? And who will be there for you? Is it family? Is it friends? Is it your roommate, especially if you're living away from home? And then what does my, specific warning signs look like when I'm having a flare of my disease? not always, but patients tend to flare almost the same way that they had presented. Do you know how to contact your medical team? It's important to have, their office phone numbers and kind of emergency planning surrounding that. And then kind of looking forward, are there ways to prevent flares of your disease, like setting alarms or, putting medications by your toothbrush to remember you to take it, or using reminders on your phone. Nameerah, I know you're going to be going to school this coming September. Do you have an emergency plan or other organizing ways to remember?
Yeah, I mean, technology is honestly my best friend, I would say. Like, I use a bunch of like those health apps. So I have like the medicine app that reminds me to take my meds. It makes like a pill shaking noise. I have like my medical history app, so it just has like pretty comprehensive medical history of mine just uploaded onto the app. And I'm actually just working on getting like the medical alert bracelets for having blood thinners, which is something like a lot of people do. Like, for if you're on a specific medication or if you have allergies, it's great to have that just as a warning for healthcare workers. And then I also just have like, I have my immediate family and all my close friends, like they know my health pretty well, and they know like if I ever hit my head or things like that, like they know what to do. They know what to inform the first responders of. So I would say definitely inform anyone who's around you, just to know like your brief medical history. They don't need to know everything, just the main things. And yeah, I also am like registered with my school's accessibility services, and I've made myself like known to have like I have my illness, so people know that I have resources and supports available to me. And yeah, I would just say mainly use your phone. Like you're with your phone all the time anyways, so it's my best friend, because I know I have a lot of issues taking my medications, as Dr. Wong knows, so having that reminder can really help.
Absolutely. And you've been so good, Nameerah. So don't be so hard on yourself. All right. So moving on to school and work. If you're thinking about or applying to attend post-secondary education, it would be good to work with your guidance counselors kind of early on, as well as your medical team, to ensure that the continuity of care is smooth, depending on where you end up, either within province or outside. As Nameerah mentioned, coming from SickKids, the Lupus Clinic, we generally refer to the young adults lupus clinics at either Mount Sinai or Toronto Western Hospital. So if you stay kind of within the GTA or even within Ontario, we end up kind of shifting you to one of those two clinics. Thinking about paying for school, it's important to apply to Ontario Student Assistance Program early. There's also a number of grants and scholarship and bursaries for patients with lupus, as well as other chronic diseases. So you might as well try to make use of that. And then in terms of accommodation, so sometimes we don't want to think about needing accommodation at school, but when you need it, and it's important to really have that plan in place. Generally, we recommend all our patients to be aware, as Nameerah mentioned, access centers, the disability offices, as well as applying early. As some patients already have some accommodations from high school, and these can continue on into post-secondary as well. Especially if you end up leaving home and you're living on residence, there's other kind of paperwork that your medical doctor can fill out if you needed, special accommodations for your residents, or separate rooms, or separate bathrooms, or how close you are to campus. You're able to kind of make those accommodations as you need. And it's better to have them in place, and if you don't need it, that's fine. But when you do need it, it's good to have that already set up. Okay, and then thinking about drug coverage. So most schools have, kind of a generic student health plan that, you're open to enroll in. Your parents may also have private insurance, and you may have extra coverage if you're attending school. But it's also important to look at if you end up not going to school, to see kind of what coverage you have kind of going forward. And then kind of lastly, looking at employment. So some may choose to take a gap year or kind of work before they enter university or college, or even after you graduate. It's good to be aware of the Accessibility for Ontarians and Disabilities Act. So when you end up getting a job, you are entitled to certain accommodations, so certain breaks, or if you need a chair to sit on, depending on kind of what your responsibilities are. Okay, so we're going to move on to some common adolescent topics. And I'm not here to tell you what to do, what not to do. I just want to bring up some topics to kind of take a moment to think about how this potentially could affect your lupus. We touch on relationships, so contraception, pregnancy, substance use, vaping, marijuana, as well as kind of mood, so anxiety, low mood, okay? So starting with relationships, I like to review consent. You don't always talk about it, but it's important to have consent in relationships. So it should be voluntary, it should be informed, and you should think about your safety and how comfortable you are with your partner. Talking to your partner about your diagnosis, it's very highly individualized. So I'm not going to offer specific advice on what to say or how to say something, but you can talk to your doctor about that, kind of how to bring that up with your partner. Because, as Nameerah had mentioned, if you end up going away for school or having some close family members who know your medical condition is really important in case things go wrong or you're unconscious and you need someone else to be able to say, do your couple liners to the paramedics if ever needed. Also looking at kind of with your partners and STI testing. If you are sexually active, it's important to get screened regularly. Condom use is good, but it's not 100% to kind of fully eliminate the potential of contracting STDs. And it's important to kind of consider emergency contraception if needed. And I would talk to your doctors as well to make sure that whatever emergency contraception that you end up using is safe for you. And then looking at contraception. So certain methods of birth control may be safe, depending on, certain conditions or certain autoantibodies that you have in your blood, more specifically the antiphospholipid antibodies in your system. So it's important to discuss with your doctors before starting any type of contraception. Generally, we do touch on this during clinic visits. We do recommend an IUD for most, if not all patients, as it's generally safe, regardless of your autoantibody profile. And then looking forward into family planning and pregnancy. Sometimes it just feels super far away. But again, we may need to make changes to your medication. We may be referring you to a different doctor. And it's just important to have your lupus well controlled even before you get pregnant. And we know with pregnancy, your lupus can change or possibly flare throughout that period. So it's important to have your disease well controlled. We probably don't mention too often, but your autoantibody profile can also affect the baby. And you may require, more frequent monitoring for screening for possible neonatal lupus, which is very different than the adult type of lupus. You do require kind of routine fetal echocardiograms to screen for heart block, although this is kind of beyond the scope of the presentation. But, when the time comes, it is important to bring up with your doctors. So this is one resources I like to share with my kind of adolescent patients. So it's sexnu.ca. It's a website developed by the Society of Obstetrician and Gynecologists of Canada. It provides evidence-based information about sex, birth control, and it's overall a really good resource. But again, to reiterate, your doctor is the best resource for this information that's specific to you and your medical history. If you're not able to talk to your doctor, we just kind of want to share trusted resources with medical kind of accurate information rather than what you see on, Instagram or TikTok. Okay, so we're going to briefly look at kind of substance use and some effects that we know that can affect your lupus. So vaping or smoking of cigarettes, we know it's addictive. We know there's long-term effects in terms of exposure to the nicotine, risk of lung injury, other known effects to other parts of your body, like your brain, your heart, your blood vessels. Similarly with marijuana or cannabis, we also know it's addictive. There's known effects on the developing teen brain, and heavy use can be associated with mood disorders and psychosis. And then alcohol. So, as we know, it can slow your reaction time, lower your inhibitions, and in combination with certain medications like methotrexate, there can be risk in terms of damaging your liver. Overall, substance use is almost like a stressor to your body, which in turn can possibly affect your lupus or cause flares of disease. So it's just important to kind of take a moment and think before you make certain choices. And this is another resource I like to bring up with patients. It's called drugcocktails.ca. It's a great website. It's actually developed by the team in BC Children's Hospital. It provides information about interaction between, say, alcohol or certain recreational drugs and prescription medications. So, for example, if you type in methotrexate, and there's a drop-down menu for kind of different substances. And when you look, say, at alcohol, this page here will show you that, it says serious risk for harm and liver damage in combination. But again, you should be talking to your doctors about this. That's specific to you. Okay. So now we're going to move on to mood changes. First and foremost, it's common. It's super, super common. Up to 60% of lupus patients describe having low mood at some point during their disease. Even overall, 12% of Canadian adolescents describe having depression or low mood. 35% of lupus patients describe kind of anxiety type symptoms. 5% of the general kind of Canadian adolescent group. Similarly, 34% of Ontario high school students, if you survey them, describe moderate to severe psychological distress. It's important to have a safety plan, especially when you're having low mood, and knowing who to call, letting your doctors know that you're feeling this way, and knowing that you don't need to kind of struggle alone. I know, Nameerah, you wanted to share your experience with that as well.
Yeah, I'm quite open about my experiences with my mental health alongside my physical health. And definitely, like, I would say, my lupus affected my mental health quite a bit over the years. And I would say, like, at SickKids, there was always someone, I think like every few visits, there was a social worker who checked in with you, asking about your home life, like, how do you feel about your lupus diagnosis, things like that. So that was always really nice. I would say when I was a patient there, I would always, get a chance to talk. And if there was something really serious going on, they would connect you to resources. Like, there was a time when I couldn't afford one of my medications, and the social worker connected us with, like, an amazing resource where we were able to get funding for the medication, which was a big burden off, like, my family's shoulders. And yeah, as an adult, I will definitely say my mental health journey was a little bit more stressful. I think just getting taken as more seriously as a kid versus an adult, and then just the isolation of the pandemic, I would say, created a great environment for mental health to go down. But I had some, after talking to my doctors, Dr. Wong, and even talking to my GP, I was able to get a lot of support. I was in support groups and doing, like, CBD and DBT therapy. So that's been really helpful for me. But honestly, like, especially for kids who have chronic illness, like, I think a lot of them would experience these mood changes. So the best thing is to honestly, like, speak to your doctors. They care a lot more than you think. Like, in the past few visits for me, honestly, like, my lupus has been okay, but my mental health has been of more concern, but it's never treated as less important, because it's equally important, of course. So yeah, just always talk to your doctors and your loved ones and your family, because there's a lot of, like, resources, not amazing resources. There could always be better, but there are things out there for patients. So don't lose hope. And it's very normal as a part of lupus to go through depression, anxiety, mood changes, things like that.
Thank you so much, Nameerah, for kind of normalizing everything. It's very nice to hear. Okay. So from the SickKids side, we have been focusing on mental health screening during visits within the lupus clinic. This is just a kind of a smaller screenshot of the handout we provide all our adolescent patients. This includes kind of general resources. The website at the top is aboutkidshealth.ca/mental health, which has really good information and is kind of evidence-based as we had suggested. And then accessing other mental health services like Kids Help Phone. There's some self-directed cognitive behavior therapy that you can access as well. So it's just important to know that these resources are available to you. So what does the future hold? Prevention is the key. Honestly, the best advice is to see your doctors regularly. Try your best not to miss your appointments. If you do, that's totally fine. Just make sure you rebook and you don't get lost to follow up. Make sure you do your blood tests ahead of time for clinic. Make sure you do your regular eye exams. We're going to ask you every time. Take your medications as best as you can, even during exam period, even during stressful times in your life, because that's probably the worst time that you want to flare in your disease, when you're already stressed out. Remaining physically active, finding an activity that you enjoy, that moves your body. It's good for your health, it's good for your joints, it's good for your heart, your muscles. And then find your joy, regardless of what it is. It's important to your mental health and your overall physical health, and kind of just longevity, kind of your health going forward. In the end, when things go off the rail, lean on your medical team, other support surrounding you. Don't hesitate to ask for help, because we are here for you. Okay, so in conclusion, there's some topics we had touched on, including knowing your disease, priorities, the importance of a emergency plan, what the future may hold, and changes that you would expect, and then in the end, taking ownership of your health. Everyone's journey with transition is different, especially kind of the non-medical parts of the transition is so different. I'm not going to give you much way of specific advice today. What I wanted to do was to just give you food for thought, things to consider, common themes that come up around transition, to arm you with the information that you need to be your own advocate, and to ask your doctors how these issues will apply to you and your healthcare. We're here for you. We're a source of information. It's a safe, confidential space to ask questions, not only about your health condition, your treatments, your medications, but how all this kind of plays out and how this kind of impacts other areas into your life and into adulthood. So it's a team, regardless of where you go. And that's it for Nameerah and I. We have some time to kind of open up the floor to any questions, any last comments that Nameerah might want to add. And I want to thank her again for being so honest and candid, sharing your story, and just normalizing things for some of the young adult listeners.
Thank you, Dr. Wong. Yeah, it's always my pleasure, honestly, to tell my story and, for someone to learn something new about lupus or people's with lupus journeys. So it's always great to be part of these things. I just want to say, to anyone who may be transitioning, the biggest thing, Dr. Wong's mentioned a few times, you have to really believe in yourself. No one knows your health better than you do, of course. You are the person who's been through everything, and so just be the best advocate for yourself that you can be. The more your medical history, I will say, the more the doctors will probably listen to you. So know your stuff. Be confident that your treatment, your history, and the doctors will cooperate. You have to just fight a little bit, especially if you're seeing if you're in the ER and you're seeing a doctor who's never seen you before. I think that's where people experience the most friction. Just really try and stand your ground and know your health and your limits and your boundaries, I would say, is my best piece of advice going into the adult healthcare world. It was my pleasure to be a part of this webinar, and thank you again for having me.
Wonderful. Thank you both so much. This was an amazing presentation. And Nameerah, I'm just going to echo what Dr. Wong said too. I love the way you kind of own your health journey and everything that happens with the transition and the responsibilities that come with it, and how you kind of present that in a way that isn't daunting to people, and in a way that really is empowering, and people can actually do this and get through it and manage the transition and thrive in it too. So thank you so much for sharing your experience with us and taking the time this evening too. I'll just remind people who are attending here this evening, you can pose questions in the chat. There's a Q&A section within Zoom as well that you can use to pose your questions. We do have one in there right now, and then I think I have a couple that I might pose to each of you also if I can. So the one that's in the chat currently the question is, what is the best way to meet others who have lupus similar to yours? And so before I kind of open it up to that, I'll just kind of plug Lupus Ontario a little bit in that we do have also support groups that we offer. They're free, they happen monthly. They take place all around the province of Ontario. And we also have other information that we'd be happy to share if somebody wanted to reach out to us, either by email or through social media. We certainly have some resources that we can share to help connect people and bring people together at certain times as well, either scheduled in monthly events or otherwise. But I'll turn it over perhaps to you both. So what is the best way or any tips or tricks you may have to meet others with lupus similar to yours?
I mean, from I guess the doctor perspective, Lupus Ontario, other support groups within the province and kind of nationwide, you can ask your doctor specifically to see kind of what's locally available to you. Within that, I know Cassie and Friends is also a really big group, and although they do focus a little bit on arthritis, there are lupus specific groups and teen events as well, and they do talks about transition and other kind of similar topics. So that's my little plug for a different support group as well. And then I don't know if Nameerah, you've accessed some of these groups as well yourself.
Yeah, so I am part of the Young Adult Lupus Ontario support group where I've met quite a few amazing friends. We even met up, got coffee, and yeah, so it's been great. Like, I would say the support groups are an amazing place. And also I've been just like perusing online, like there's a lot of Instagram pages for people who advocate about various chronic illnesses they may have. If you just type in like a hashtag, like hashtag lupus or hashtag chronic illness, you'll actually come across quite a few accounts. I've connected with people that way through Reddit. There's forums online. There's different like communities available online too. So if you go searching, you might be able to find it. But yeah, like there's a lot of people out there you'd be surprised who have lupus, and there's a lot, and I think most of them are like yearning for friends who kind of understand the experiences that you go through, because it's very different and unique.
Wonderful. We have another question in there as well. So that question, and it actually touches on something that I had a couple of questions around too. So this might be a good gateway. Is there mentorship offered in the transition process? So for example, learning from others. And I'm assuming that question can really be applied to the patient, so someone in Nameerah's case, and even to the physician as well, as that transition kind of takes place.
Yeah, no, that's an excellent point. I don't, formally at SickKids, we don't have that specific mentorship. I think if there was more interest, at least those for people who have recently transitioned, but that is a great idea. I think it would be really nice to be able to match, people that are soon to be transitioning and kind of mentorship throughout the years. I think that's a great idea, but we do not have one formal kind of in place at SickKids, unfortunately.
I think that's a great idea.
So I'm going to kind of borrow from that a little bit and ask a question of my own. So I think I'm going to take two perspectives of it. So the first one is the physician side. So when you have that kind of transfer of knowledge, that handoff from the pediatric side through to adult care, Dr. Wong, could you maybe walk us through a little bit of what that's like, how that happens? Is it a full kind of just, here's a patient file, good luck, or is there kind of a debrief between physicians? And then Nameerah, I think I'll maybe come to you and kind of get your experience with what that transition was really like going through that.
Yeah, no, absolutely. So kind of like behind the scenes. So we're actually preparing for our next transition clinic in August. So we organize kind of certain times throughout the year, alternating kind of between Mount Sinai and Toronto Western. And we put all the 17-year-old, 18-year-old kind of soon to graduate patients in those clinics. So first part, kind of homework on our end, is that we kind of divvy up the patients and we write a complete medical summary, which, honestly, you could ask for and print it out, and that could be part of your file as well. And we go through since diagnosis, your autoantibodies, every manifestation that you've had, any complications, and all the treatment, medications that you've tried or failed, and kind of current treatment. We also look at bone health. If we've done like bone density scans, make sure your eye exams are up to date. any other kind of comorbidities, if there's mental health, was social worker involved, was adolescent medicine involved, and we summarize essentially your whole journey from SickKids. So it's a bit of a daunting task, but it is something that we hand over, paper copies, plus we send the letter to Dr. Steinman and to Dr. Tuma prior to transition. And during those visits, again, you get to meet both either Dr. Steinman or Dr. Tuma, depending on where you end up going. So you see kind of face to name. We give you a little folder on their contact information as well before you get handed over to them. And then, besides the debrief, fortunately, there's fellows like me who work in both sides. So I might actually see you on the other side of transition, and I know your history. So I'm able to kind of summarize to them, because there's a lot of patients and it's hard for them to kind of keep track because we know you so well. We're able to kind of hand that off and make sure that everyone knows your background before you go. That's just on our side.
Yeah, so there was like a whole the day of the transition clinic was probably the first time I got to talk to a lot of the people who are in clinic with me. Usually, you see each other, but no one makes that much conversation, I would say. But we were all kind of in a room grouped together where they were doing presentations about like supports available to us. And I think that was really nice, like seeing like people who were kind of in the same boat as me. Pretty, like, I think everyone was a little bit scared. No one really wanted to leave SickKids, I would say. And yeah, like Dr. Wong mentioned, like that letter that they wrote, like with the overview, that was like the first time I have ever even saw like all of my autoantibodies listed, every like flare I ever had. I still have that paper with me. Actually, I reference it a lot too, just for my own sake, but it's really nice. Like it has a pretty great summary of like all the main features of lupus and like the symptoms. And yeah, then we got the chance to meet, like I got to meet Dr. Simon one-on-one and just kind of introduced myself. She introduced herself to me. We kind of went through very briefly my medical history, but I felt like, I would say I felt pretty like confident transitioning, just because, I trusted my doctors quite a bit, like, and I knew that they cared a lot about like how our transition went and to make sure we were in good hands. So I felt pretty good about that. What else? Yeah, I think that was pretty much it. Like that day was a little menacing. We got a certificate saying you're graduates from the program, which was nice. And yeah, and honestly, it was really, really helpful. Like just like I've mentioned it a lot of times already, but I've used so many of the supports that I didn't even know were available to me, like getting funding for getting devices for school, getting OSAP grants for disabilities, things like that, which has been really helpful for me in terms of making my school and my life just a bit more accessible. Yeah, so.
Great. Thank you. I think we have an audio question. We're going to unmute somebody to ask a question here directly. So I'll let Hadra do that. And it's Andrea who will be asking the question.
Hi there.
Hi, Andrea.
Hi. I'm a SickKids grad from a couple of decades ago. I asked the previous question about mentorship because that is something I've been pushing for from my experience decades ago. So I've already spoken to Dr. Steinman about this, but just seeing Nameerah's reaction to the idea, it shows it's just as valid. So I really, really would like to push this forward. I'm so dying to get involved so much. I love how much progress has been made since the time I transitioned. It just sounds so weird to say transitioned. I don't really like that word because of today's day and age. With to transition, I'm automatically thinking of gender. But anyway, yeah, that one-page summary, I think it's so helpful just to familiarize the patient with the formal dialogue, like the terms and all of those procedures and all of the badges, in a sense, that you wear with your lupus portfolio. Because, hey, you earn a lot of badges. I mean, Nameerah, you've got the blood clot badge, like the big one for sure, and the double lung pneumonia thing, and then I've got CNS badge and that type of thing, so it would be so great in an ideal world to figure out how we can make these mentors a reality. My psychiatrist at the time at SickKids, had encouraged me to get, some type of group and connect with other people just in the clinic. So I literally just approached people there and started a little list, but I'm way beyond that now. And I just see the need is still there. The groups are great. It's monthly, you can reach out, and I think that's wonderful. But just in that transition day, could you imagine establishing a buddy who's already in the system where you can go and speak to someone who we all know that every lupus case is very unique, and you have your own set of your own combo of symptoms, pills, everything. But still having that understanding and just knowing someone that's been through it and having that visual success story. Nameerah, uh, I know, I know that you met a really good friend of mine, Susan Haraki, at the walk recently. And so that's exactly it. So I know Susan from way back. I grew up with mentors, the odd mentor here and there, but it's such an invaluable thing, Dr. Wong. Like I don't know. I've spoken to Dr. Silverman about this, also Dr. Simon, but I joined this webinar to do the same thing and just to ask that question to see Nameerah's response with, how does she feel about having a buddy? Could you imagine having all of that on top of the useful sheet that you received for all of those supports, where you get funding and everything like that? It's amazing how much progress has been made, but I think the cherry on the cheesecake that you can't even describe the value of it is still needed.
I mean, thank you so much, Andrea. Like, I think in ideal world, I think that's a perfect idea to implement. And I was going to reflect it actually back to the audience and Nameerah in terms of other ways that we can improve, because that 1-day transition, we say we should be transitioning since the age of 14. We probably don't do the best job, and we start focusing, oh shoot, you're turning 17, 18 in the next year, we need to start planning. So if there's other ways that we can kind of make that transition smoother, and I think to your point, Andrea, about having mentorship, given that we have a few more transition clinics, and I'm still here for a little while. I can bring this up to Holly. I don't know if she was one of the nurses that's currently at SickKids for the Lupus clinic, because she helps kind of organize the transition folder that they all get. We can at least ask the new grads that are going forward. We obviously can't implement a mentorship program in this short period of time, but we can add a question. Are you willing to be contacted to become a mentor? I think we could leave it open like that, and then collect certain emails and then provide that going forward, kind of subsequent grads. I think that's at least a first step.
Oh yeah, I like that idea. I mean,
right?
there's training, like even with
voluntary.
volunteering, there's training that has to happen as volunteers. Like, you are not medical professionals and all of that sort of thing. So I understand the liabilities there of just, not giving advice and things like that. But honestly, just to have that person who genuinely understands, it's sort of like the benefits of the support group, but all the time as a contact person. You don't have to wait for that meeting. Let's say Nameerah has just a stressful moment or something. It's like, oh, I just need to talk to someone who gets it. And, they have that almost big sister. It could be a big brother, because men get lupus too, but just someone who might have similar, maybe one affliction that's similar, or maybe it could even be an ethnic, because that connects people as well. There's definitely higher lupus, cases in different populations, and that might help a connection as well. There's just so many levels of this, but it's really is my dream of seeing that happen and doing what I can to help make it happen.
No, I thank you for that plug, and I'm happy to bring it up to Dr. Silverman and Dr. Simon and Dr. Levy and the lupus team at SickKids to see if we can make some change. Thank you for sharing that.
They'll recognize the name. They'll be like, her again? Oh my gosh, she won't give up.
Well, good ideas have a way of persisting, right? So maybe this is another way to bring it forward, bring it to life. And Dr. Wong, you're your suggestion there, just kind of off the cuff, I know, but maybe it's a good one to get started to see if people would want to be involved in such a system, in a buddy system. I know we're bumping up against our time. I do have just one more question, maybe two, but the one is very quick. So kind of going again back to the sequence of events when it comes to transitions. So Nameerah, you seem to have had a really great experience. Obviously credit to yourself and also to your care team. How much of that transition was kind of planned out? Did it start really early, kind of preparing you for that eventuality? Was it just more so leading up to that one day or that time when it was to happen? How did that come about?
I would definitely say like I was preparing for my transition like from the age like 16, 15. Like I was pretty independent at that point, like when it came to my health. I didn't really need, like, I tell my parents there's no point in two of us waiting in waiting rooms when one of us can just do it, you know. So I would often take charge in that kind of way. And I was also pretty well aware of treatment options that were available to me as an adult. Like for my APS, my antiphospholipid syndrome, there's a lot of treatments that for blood thinners that I could only take once I was an adult, and I was really waiting on them. So I feel like I was kind of mentally prepared for that as well. Like my doctors were always informing me about new medications and new treatments. So in the back of my head, I was also like aware of those things. But I like in terms of transitioning, like I even prepared like my parents, like, you know, you're gonna have, you know, we're gonna not be able to go to the sick kids ER anymore, which you get treated very fast. Like we're gonna be in the main, like the big ER. So it was a big change for my mom, I would say. And like honestly, like it was just a lot of, like, I would say mentally preparing myself, like just for the changes in environment and the changes in support. Like the access to healthcare is pretty much similar. It's a little bit more, you have to again advocate for yourself and you have to push a bit more, but the treatment options are available. But I would say the environment and the way you're treated is a little bit different, of course, as an adult versus a kid. But for me, like my transition, like I would definitely say like I felt very prepared. My doctors always kind of told me like, and I was always like told, you're very independent. And like when you're told that, you're like, you want to stick by, like, oh, I'm independent, I know how to do my thing, I know what I'm talking about. So I was always kind of like that from a young age.
Well, I like the little caveat you put in there that you know, transition isn't just something that you go through as the patient in a pediatric system moving into an adult. It's a family thing. It's a caregiver thing. Everybody goes through it, and you really became that point person in your family too. So that's wonderful. It seems like you really took charge of everything all the way through, and it's really paid off.
Oh yeah, the big one was, you know, in sick kids, you can have your parents stay with you in the room. They have a bed. But an adult system, you're usually sharing your room. Like I was sharing a room with 3 people. So that's like, I think was a big, like that's a big one that people don't know, or having your own bathroom, even having your own room. Like these are like things that in my head, I was like, oh yeah, this is like, that's the usual, right? But cold awakening later on.
Yes, yeah. My final question, I think we've kind of touched on it. Dr. Wong, I think it's for you, but Nameerah, again, feel free to jump in too if you went through this as well. You mentioned in the presentation, and maybe just me mixing things up in my mind, there's pediatric care, there's young adult clinic, and then there's that transition to full adult.
Yeah.
So what is that process for anybody who isn't familiar with it, or how do you kind of go through that graduated system?
Yeah, no, that is a really good question. So I mean, from the sick kids side, generally roughly the age of 18 is kind of the cutoff, or kind of right before your birthday or soon after your birthday. I think you're not allowed to essentially come to SickKids Emerge. So we have to kind of see you on the adult side. So as we said, generally we refer our lupus patients to Mount Sinai or Toronto Western. You'll be seen with Dr. Silverman. So he'll be the pediatric rheumatologist side, and then either Dr. Tuma or Dr. Steinman on Mount Sinai. And they will see you together, you know, with, you know, but you'll see both of them during the visits, plus or minus like a fellow like me, up to about the age of 22. So they do get to keep you for a few years. And then beyond 22, then we just essentially just transfer you to either Dr. Tuma or Dr. Steinman's you know, their normal clinic, which is in the same hospital, in the same office. So that feels a little bit more familiar, and we plan that going forward. So we'll say, okay, we will see you one more time in the young adult clinic, and then 6 months from now, 9 months from now, you'll be officially transferred to the adult side. But we do keep you for a little bit longer in the young adult clinic.
Not a really strict transition. There's a bit of an easing into it. Wonderful. Excellent. I'm not seeing any more chats or questions coming through in the chat. So again, I'd just like to say thank you both so much for joining us. This has been tremendous. I'm sure everybody's getting a lot out of this this evening. And again, maybe we can have you join us in the future as well for a similar conversation. And Nameerah, you can get us caught up to date on how everything is going at school and what that transition was like too.
For sure, it's a nerve-wracking one.
Well, thank you very much again. And Hadra, again, thank you for all your support in the background too, and everyone for joining us this evening and the questions that came through as well. We really appreciate it. If anybody has any other questions, feel free to reach out to Lupus Ontario. We can connect everybody. If you also have any suggestions or topics for future events, please let us know. We'd love to have them so that we can make sure that you're getting the content and the material that you'd like to see as well. So with all of that said, I think we'll leave it there for this evening. We're a couple of minutes over time. But again, thank you very much, and everyone have an absolutely terrific evening.